Rahim. What are the key questions of the weaning, or the three questions of the weaning? We have three questions you have to ask yourself during the weaning time or before extubation. The first question actually it will be, is the cause of respiratory failure gone or getting better? So why you intubate this patient? You intubate this patient due to what? Or you ventilate this patient due to what? Due to respiratory failure, hypoxic respiratory failure, or hypercapnic respiratory failure. It's due to oxygenation problem or ventilation problem, or both due to oxygenation and ventilation. So you have to ask yourself, is the cause of respiratory failure gone or getting better? So this is the cause of the intubation or ventilation is gone or getting better. Sometimes you intubate this patient or you ventilate this patient due to oxygenation problems. It's due to hypoxia, hypoxic respiratory failure like PPHN or meconium and all of this, or it's due to ventilation problem, hypercapnic due to pneumonia, pneumothorax, or whatever the cause. You have to be sure, is the cause of respiratory failure gone or getting better? This is the first question you have to ask during the weaning time. The second question actually is, the patient is well oxygenated and ventilated. What does this mean? So oxygenation and ventilation again. Oxygenation, ventilation. So how much the FI oxygen the patient is required? As we know, if you are going to wean this patient, if the oxygen more than 50, you have to wean by 10. If less than 50, you have to wean by 5. So to reach to 30 to 40%, 30 to 40% of the oxygen requirement, or FiO2, or fractionation of inspired oxygen, fractionation of oxygen. And for sure it's guided with oxygen saturation, and you have to look for the PO2 in the blood gas, partial arterial of oxygen in the blood gas. It will be 60. So it will be the oxygen requirement, or FiO2, it will be 40% the oxygen requirement, and the PO2 in the blood gas is 60. It will be 100. You see, to memorize from your heart. So FiO2 it will be 40% the requirement, and in the blood gas the PO2 it will partial arterial of oxygen, it will be 60 millimeter mercury, and you have to guide the weaning of the FiO2 by what? By the saturation and blood gas. Ventilation it will be two parts. You have to wean the modes and parameters. The patient in AC, then SIMV, then the pressure support ventilation, then the CPAP. So you have to wean the mode first. After you wean the modes, you have to wean the parameters. What parameters you have to wean it? Three parameters, the most important for the weaning. It will be the FiO2, this is already we discussed it, and the ventilation, it will be the rate and PIP, to peak inspiratory pressure, So the rate, it will be guided with the BeSO2, the partial arterial of CO2, and also it will reach to what? You have to reach to 25. Our limit 25. If oxygen, our limit 30 to 40%, and our limit it will be 25. How it is 25? The patient, the physiological rate, it will be 40 to 60 breath per minute. Why you will wean to 25? Is not physiological. Actually, the patient, it will before you reach to this one, you have to be sure about this patient is breathing spontaneously, physiological breath. This is 40, he reached 40 and 60. So this is the lowest rate for the ventilation as pickup for these patients, but you have to be sure this patient is breathing physiologically 40 to 60, having spontaneous breathing. So you have to wean the rate up to 25 by 5, and the guided with the PeSO2. And the second part for weaning, it will be what? The PIP, the peak inspiratory pressure. It will be guided with minute ventilation or tidal volume, and also what is the lowest limit for the PIP? It will be 12 centimeter water. This is it will be the lower limit for the PIP for the weaning, and you have to guide it with tidal volume or minute ventilation. So you have three parameters for the weaning. It will be the FiO2 oxygen, or the fractionation of the oxygen. It will reach to 30 to to 40%, guided by saturation and PO2 it will be in the blood gas 60, and also the rate it will be guided with the PCO2, and also it will be the lowest rate you reach it will be 25 breath per minute, and the peak inspiratory pressure it will be guided with tidal volume or minute ventilation to reach it to 12 centimeter water. So the oxygenation you have is the patient is well oxygenated and ventilated. Oxygenated, so the oxygen requirement is 30 to 40%, and the PO2 in the blood gas is 60, and the saturation is maintained. The saturation is maintained according to target oxygen saturation based on the age of the patient, is preterm or full term. Ventilation, we said mode and parameters. Mode, AC, then SIMV, then pressure support or CPAP, and parameters, it will have three parameters. It will be the oxygen, it will be 30 to 40 and guided with oxygen, and the rate it will reach it to the lowest rate 25 breath per minute and guided by PCO2, and you can decrease it by 5. And the oxygen you will decrease with, if more than 50 you have to wean by 10, if less than 50 you have to wean by 5. And the PEP, peak inspiratory pressure, so you have to wean by 1 to 2 centimeter water and guided with main ventilation or tidal volume until to reach the lowest pressure it will be 12 centimeter water. The last question you have to ask, can the heart tolerate increased work breathing? So you have to be sure about the hemodynamic stability of the patient. Hemodynamic stable. Actually, this is the 5 parameters for weaning or criteria of extubation. The first one, it will be what? CNS. So this patient is minimal or no sedation. So be sure that there is respiratory function is working and functioning. The second, it will be cardiac, it will be no or minimal inotropes, so hemodynamically stable. And the third one, the ventilation. The ventilation, 2 parts. Good respiratory drive, this is no apnea and no sedations, and good respiratory effort, so the patients can take breath or the physiological breath above the lowest rate you put it during the weaning. And the fifth one, it will be acceptable blood gas. So it's 5, so there's no sedation or minimal sedation to be sure the respiratory drive it's functioning. And the second one, it's no or minimal inotropes, so hemodynamically stable. And the third one, it will be related to respiration, minimal ventilatory setting. So the modes, you have to wean, the AC, then SIMV, then pressure support, then the CPAP, and minimal ventilatory setting. You have 3 settings, the most important in weaning, the rate, FI oxygen, and PEP. FI oxygen, it will be less than or 30 to 40%, and PO2, it will be 60, and guided with oxygen saturation. And if the oxygen is more than 50, you have to wean by 10. If less than 50, you have to wean by 5. And the rate, it will be guided by PCO2, the CO2 also, and the lowest rate you reach it to is 25, and you have to wean by 5 breath per minute. And the PEP, it will be guided with tidal volume, and you have to wean by 1 to 2 centimeter water to reach it to 12 centimeter water. This is the lowest PIP you reach it, and guided by tidal volume. And for sure, you have to ask the heart is tolerated and increase work, tolerate the increase in the work of the breathing. This means hemodynamically stable. So we have 3 questions you have to ask during the weaning time. Is the cause of the respiratory failure is gone or getting better? It's hypoxic respiratory failure or hypercapnic respiratory failure, or both hypoxic and hypercapnic respiratory failure. So be sure the cause of the intubation and ventilation is gone or getting better. The second question, this patient is well oxygenated and ventilated. What does this mean? The oxygenated, this means the FI oxygen requirement, it will be 30 to 40%, and the PO2, it will be in the blood gas is 60 millimeter mercury, and guided with oxygen saturation. Ventilation, this is 2 parts, the mode and parameters. Mode, it will be AC, then SIMV, then pressure support and CPAP. And the parameters, you have 3 parameters, the FiO2 oxygen, we discuss it, and rate and also the PEP. the rate it will decrease by 5 until to reach to 25 breath per minute, guided with PCO2, and also the PIB it will be decreased by 1 to 2 centimeter water until to reach the 12 this is the lowest, it will be 12 centimeter water guided by minute ventilation or tidal volume. The last question, can the heart rate increase in the work of the breathing? This is hemodynamical stability, because the criteria of extubation we said 5. CNS it will be no sedations or minimal sedation, so be sure the respiratory drive it's good, so is no sedation and there is no apnea. The second, the cardiac it's no inotrope or minimal inotropes, so this hemodynamically stable. Respiratory 2 parts, good respiratory effort, good respiratory drive, this means no apnea and no sedations. Good respiratory effort, this patient is breathing spontaneously above the stated rate you put it. And lastly it will be acceptable blood gas. ومن أحيا فكأنما أحيا الناس جميعا. شكرا، سلام.